Hi, Dr. Shmaila here. Today we'll start with chapter number 4 of kinesiology, that is starting position. Today our learning objective, what are the starting position, purpose of the starting position, types of the starting position, detailed discussion about fundamental standing positions along with muscle work and effect and uses. Derived position of the standing along with modifications will also be discussed along with their muscle work and effect and uses. Starting position. What is starting position? The posture from which movement is initiated is called as starting position. As you are seeing in this picture, these may be either active or passive in character. Starting positions is applicable for day-to-day activities. Sherrington stated that posture follow movements like a shadow, means every movements begin in posture and in posture. The position which adopted by the patient or individual to perform exercise or movement to gain relaxation and stabilize their body. For example, drinking bad tea. The person has to come out of the lying posture and attain sitting position to drink the tea. So every activity which we do, our daily life activity, starts in one posture and in other posture. Equilibrium and stability is maintained in these positions by balance of forces acting upon the body, and when forces of muscle contraction is used for this purpose, this force of muscle contraction is isometric. It means static muscle contraction. The strength and distribution of this contraction is normally controlled by a series of reflexes that we call as posture reflexes. But during the learning process of new patterns of posture, voluntary effort may be required. Selection of suitable starting position is made according to the purpose for which they are required. This may be to utilize sport, essential for relaxation, to train correct posture and balance, to achieve adequate fixation when movement is to be localized to a specific joint, to modify the effect of the exercise. Types of the starting position. There are two types of starting position: fundamental position and derived position. There are five basic fundamental positions, namely standing, kneeling, sitting, lying, and then hanging. All other positions which are used are modification of one or other of these five, and therefore they are known as derived positions, each modification being designed for specific purpose or effect. So what are the purpose of derived position? The position of arms, legs, or trunk is altered in fundamental position to modify effect of the position or to start exercises. Purpose: to increase or decrease size and stability of the base, to raise a lower center of gravity, to ensure maximum local or general relaxation, to control or fix the particular part of the body to have localized the movement, to increase or decrease muscle bulk, to increase or decrease leverage, and to provide convenient position to start exercise. Means when you are in standing position, then base is narrow, but obviously when you are standing close standing position, then base is too narrow, and this concept is basically used to specify to increase or decrease size and stability of the base, to raise a lower center of gravity, for example sitting and then standing, to ensure maximum local or general relaxation. Obviously in lying position you gain maximum relaxation. Particular part of body, when you fix it, then you localize movement to that part of the body, to increase or decrease muscle work. Obviously you, when you modify the position, um, muscle work may be decreased or maybe it increases. To increase or decrease leverage. Obviously if muscles are very strong, then we use long leverage, and it is very important to provide convenient position to start any exercise. Now start with fundamental standing position. Standing. Look at this picture. This is the most difficult of the fundamental positions to maintain, as the whole body must be balanced and stabilized in correct alignment on a small base by coordinated work of many muscles. The position may be described as follows: heels together in the same lines, toes slightly apart, knees together and straight, hips extended and slightly laterally rotated, pelvis balance on femoral heads, spine stretched to maximum length, vertex thrust upwards, eyes level and eyes look straight forward and ears leveled, shoulders down and back, arm hangs loosely to the sides and palm facing inward towards the body. Muscle work. Muscle work required to maintain the position varies with circumstances. Decreased when the body segment is in good alignment and perfectly balanced, but muscle work increases by the faulty alignment or by the external forces that disturb equilibrium. To hold the position, anti-gravity muscles of the trunk and lower limb work isometrically. Muscle work, look at this table. Intrinsic muscles of the feet stabilize feet and prevents toe curling. Then roll of plantar flexors, balance lower leg on foot. Dorsiflexors balance, counterbalance the action of the plantar flexors. Beside this, dorsiflexors also support medial longitudinal arch of the foot. Everters counterbalance the action of the inverters, presses ball of the great toe on the ground. Knee extensors slightly work. Hip extensors maintains hip extension and balance pelvis on the femoral heads. Hip lateral rotators, slight action. Hip lateral rotators basically bracing of legs and foot arches. Spine extensors keeps the trunk upright. Lumbar flexors are your abdominal muscles. Prevent overaction of the lumbar extensors, maintain correct angle of the pelvic tilt, and they also support abdominal viscera. Prevertebral neck muscles control excessive neck extension, straightens basically cervical spine. Flexors are extensor of the atlanto-occipital joint, works reciprocally to balance head, because as you know, occipit is occipital protuberance. You can say it as C0 vertebra and C1 at atlas, that is atlas vertebra, and the joint between them is atlanto-occipital joint. Elevators of the mandible closes the mouth. Scapular retractors draw the scapula backward, means glenoid cavity faces laterally and arms relaxed. Look at this picture. Good posture when you are standing. Your everything is in alignment. All the muscle groups mentioned above stabilize the body in the anterior posterior direction. In addition, there must also be a balanced counteraction of the lat muscles to maintain equilibrium. The erect posture has developed during the evolution of the man, and it has to be learned and practiced by every child. It is the position of the perfect balance which requires the minimum of effort and the position itself, and the muscle work required to maintain it must vary considerably in accordance with the anatomical structure of the individual. This is, look at this posture. When we are in standing position, this is the balance upright position, and this is the poor posture in which forward head, flat back, and this true up poor posture, rounded shoulder, sway back and weak abdominal muscles. Took the example of a child as you have to learn about developmental milestones, that when the child starts neck holding, when the child will start sitting, then crawling, then standing, then walking, and there are other stages that the child passes in the development period. So their fact and chooses: small base, higher center of gravity. Obviously, you to practice while you are standing and note these points that relatively small base, high center of gravity, state of equilibrium, less stable than other fundamental position. So suitable fast exercise for those who can maintain it correctly. Attaining and holding standing posture reduces fatigue and conditions posture fluxes. Position of alertness, obviously, army persons basically stand in erect posture, and this is so called this position of alertness. Thorax is free and abdominal viscera is well supported, associated with feeling of joy and efficiency. Now we discuss about derived position from standing by the modification. You can say by alterations of arms, alteration of legs, alteration of trunk, and alteration of legs and trunks. Now one by one we discuss these positions. Positions derived from standing by alteration of arms: wing standing, low wing standing, bend standing, reach standing, yaw standing, and then stretch standing. First, wing standing. As you are seeing in this picture, wing standing. Hands rest on the crest of the ilia, fingers which are extended, inducted, wrist extended, forearm pronated, elbows fixed, and shoulder in abduction. Elbow points straight sideways, elbows are pointed. Wing standing muscle work. The adductors of the shoulder joint and extensors of the elbow work slightly to press the hands to the trunk. And effect and uses. As the arms are held away from the trunk, from the axilla to the iliac crest, position allows the physiotherapist to grab the patient around the shoulders during some trunk exercise. The fixed position of the arms prevent their swinging during trunk exercises. As the swing usually amplifies the movement and leaves the thorax free, the position should be avoided unless it serves some definite and useful purpose. It was at one time used extensively just to make the exercise appear sturdy. Example, relaxing position after prolonged walking or jogging. Then you stand like this in wing standing. Low wing standing. This is similar to the previous position, but the fingers being placed across the front of the hip joint. This is the difference from wing standing. Effect and uses. This is the point of control as the patient is able to feel the feel with the hands the movement of the flexion at the hip joint, tilting and later swing, or any other rotation of the pelvis which may occur during the performance of the exercise may be also be felt. Bend standing. Shoulders are laterally rotated and adducted strongly. The elbows are flexed, forearms supinated. Look at this position and practice this position, please, dear students, with wrist and fingers flexed to rest above the lateral border of the acromion process. Muscle work. Lateral rotators and adductors of the shoulders work strongly. Besides these retractors and depressors of the scapula work as fixators to fix in this position. Flexors of the elbow and supinators of the forearm work to maintain the position of the forearm. Flexors of the wrist and fingers may work slightly. Effect and uses. The position is corrective for the position of upper back and thorax is expanded. It may therefore be held during some trunk exercise to intensify the effect, or used prior to some arm stretching exercise. When you start arm stretching exercise, then practice this position. Full flexion of the elbow, reduces the leverage for abductor muscles of the shoulder joint, making it suitable position for which to perform abduction movements when these muscles are weak. This is very suitable position, and when we use long leverage and short leverage concept in physiotherapy, then long leverage means that muscles are very strong, and a healthy person can perform this very easily, this exercise. But short leverage means, like this in this example, shoulder muscles are weak, shoulder abductor especially, and then you have to bend the elbow of the patient, and because this reduces the leverage. Shoulder rotation exercise also performed in this position. Beside this, trunk bending exercise as well as neck exercise will also be performed. Example, policeman fixing the star in his shoulder, removing dust from the shoulder. Reach standing. Shoulders are flexed and elbows extended so that arms are held parallel, shoulder width apart, and right angles to the body. Muscle work. Shoulder flexors maintain the position against gravity. The transverse back muscles control the forward movement of the scapula on the chest wall, which is associated with the shoulder flexion. Besides this, extensors of the elbow, radial flexors of the wrist, and extensors of the fingers work slightly to keep the arm straight. Reach standing. Now look at their effect and uses. In the upright position, forward raising of the arm brings the center of gravity of the body forward, and therefore there is a natural tendency to overcompensate for this by extension of the lumbar spine. Control of the position of the scapula by retractors and depressors is essential to avoid restriction of the inspiratory movement. The position is used prior to some trunk and arm exercise in the sagittal plane, and to assist balance during balance walking sideways. The hands may be supported on or may grasp some apparatus, reach grasp standing. Further, you may modify reach standing and derive other position like reach grasp standing, and this obviates the use of the shoulder flexors muscles when the arms are used to control or steady the body for leg or head exercise. Yard standing, as the name showed, that yard standing means arms are straight and elevated sideways to a horizontal position. Muscle work. The abductors of the shoulder work strongly with the lateral data's of the scapula to stabilize the arm. The extensors of elbow, wrist, and fingers work to hold the limbs in a straight line. The tendency to elevate shoulder girdle is controlled by the scapular depressors. Effect and uses. Abductors of the shoulder work at marked mechanical disadvantage as the length of the weight arm of the lever so greatly exceeds that of the power arm. The position is therefore corrective for the posture of the upper back, facilitates body balance, and is convenient for arm swinging exercise. One arm only may be used, that is known as half yard standing. When the hand grasps a support and suitable height, then it is known as half yard grasp standing. The body is steadied for leg and trunk exercise. Palm may be turned forward. Modification further, yard palm forward standing, or upward yard palm upward standing. The latter, that is yard palm upper standing, involving an additional lateral rotation at the shoulder joint, and with consequent further pressing of the upper back muscles. Stretch standing. Arms are fully elevated so that they are in line with the body, paired to each other with the palm facing. This is the stretch standing position. Muscle work, abductors, extensors, and lateral rotators of the shoulder work strongly in conjunction with the lateral rotators of the scapula to hold the arms in this position. Besides this, extensions of the elbow keep them elbow straight. Wrist and fingers are kept in line by interplay between the muscles working over the wrist and by the extensors of the fingers. Effect and uses. Stretch standing. The muscle work is strong, often due to tension of the short and opposing muscles, particularly pec major and minor and latissimus dorsi. Obviously, there is increased tension in these muscles. Tension of the pec major muscle expands the thorax, and in inspiration, particularly expiration, is difficult. And in the upright position, the arterial circulation to the arm is impeded by the gravity. Position is therefore unsuitable for weak patients or those who suffer from respiratory problems. It is long neglected for the position of the upper back and gives a feeling of stretching the spine, as the name showing stretch standing. Elevation of the arms raises the center of gravity of the body and affords additional leverage in many trunk exercises. Elevation to the oblique position, that is known as oblique stretch standing, reduces the effect of the position. The hand may grasp some overhead support. Stretch grasp standing, or the fingers may be clasped. Stretch clasp standing. When one arm holds the position, a lateral flexion of the thoracic spine to the opposite side maintains basically equilibrium of the body. That is known as half stretch standing. These are the further modification of this position, that is stretch standing. This position is basically useful in the treatment of scoliosis. Scoliosis, what is scoliosis? Scoliosis is basically lateral curvature of the spine. Now we discuss positions derived from standing by alteration of the legs. Previously we discussed position derived from standing by alteration of the arms. Now we discuss by alteration of the legs. These positions involve change in the shape or size of the base. Only the description and static muscle work which differ from eyes. In addition to that regard for the functional position is given. Students remember that when question like any particular derived position come in paper, then according to marks attempt it as if you know about fundamental standing position, then mention all those muscles and remaining that are different, that are specific to the particular position, like close standing, then mention those and mention remaining muscles are effect and uses of the fundamental standing position. This is the example, and follow this in all positions. These basically what positions we derive by alteration of legs. Close standing, close standing. Legs are rotated inwards at the hips so that the medial posture of the feet are adjacent. Leg muscles work more strongly than in the fundamental standing position. Fact and choices. The size of the base is reduced in this case and balance is therefore more difficult. It is therefore a progression on the standing position. Relaxation of the lateral rotators of the hip often results in a loss of the bracing effect on the whole leg, including the longitudinal arches of the feet, which accompanies the contraction of these muscles when the foot is fixed. Toe standing. Look at this picture. Heels are pressed together and raised from the floor. That is known as toe standing. The plantar flexors of the ankle joint work strongly against gravity to keep the heels elevated. All the leg muscles work strongly than the fundamental standing position to keep the balance. Fact and uses. The base is reduced, center of gravity is obviously raised, so that this is used as a balance position. Strong work for the foot muscle presses the longitudinal arches, and there is a tendency for the whole body to stretch, which is of value in the treatment of the posture flat feet and posture training generally. So always remember student that highlight these points, like previously I told you about scoliosis, and now took this example that this position toe standing is used in the treatment of the posture flat feet and posture training generally. Stride standing, the legs are abducted so that heels are 2 foot lengths apart. The feet remains at the same angle as the fundamental position, and weight is equally distributed between them. Muscle work, because the width between the feet is greater than that of the pelvis. Look at this. The adductors of the hips may work to prevent the legs from sliding further apart. If the position is taken on a slippery floor, then there is a chances that there is excessive abduction, but here is the role of adductors of the hip. On a matte surface, however, or if a rubber sole shoes are worn, friction is sufficient to maintain stability. Effect and uses. Effective base is much enlarged laterally, making this an easy and stable position from which to perform exercise, especially those in frontal plane. Because, as you know, abducted position, this lady is standing, and in this abduction and adductions are performed in frontal plane and sagittal axis. Walk standing. Walk standing, as you are walking, then look at this picture. Imagine this picture. One leg is placed directly forward so that heels are 2 foot lengths apart and are on the same line. The body weight is equally distributed between them. Muscle work. There is a tension on the structures anterior to the hip and on the calf muscles of the posterior leg. Therefore, the extensions of hip and knee of this leg work strongly to maintain the position. Effect and uses. The base is much enlarged in an anterior posterior direction, stabilizing the body for exercises in a sagittal plane, because, as you know, in this position we are in box standing, and this is a sagittal plane and frontal axis, and do flexion and extension exercise. Rotation of the pelvis towards the side of the forward leg is prevented by the position of the back leg, and the position therefore may be used to localize rotation to the spine. Tension on the hamstrings of the forward leg likewise prevent forward tilting of the pelvis in trunk flexion exercise. Half standing. The whole weight of the body is supported on one leg. The other may be free or supported in variety of position. Further, we modify this position. Um, Muscle work. Abductors of the hip of the standing leg work to maintain the center of gravity over the base by slightly lateral tilting of the pelvis. Lumbar side flexors of the opposite side work to bring the trunk into the alignment. All the muscles of the supporting leg work more strongly than the standing to support the additional weight and preserve balance. Effect and uses. Half standing. In half standing, unsupported leg is free for movement. Balance is therefore more difficult as the size of the base is reduced. Leg which is freed from the body weight may rest in a variety of positions, for example on a stool with hip and knee bent. That is known as step standing. This relaxes the tension on the abdominal wall on this side and may be used after certain abdominal operations. Foot may be supported with the knee extended on the apparatus of a suitable convenient height. Foot support for standing. Support of the foot in a forward direction results in the tension on the hamstring and then straightening of the lumbar spine. And support sideways. If we support foot in sideways, then it increases the lateral tilt of the pelvis and lumbar side flexion. Finally, the toes may rest slightly on the floors. Toe support standing. This has the additional effect of the pressing the arches of the foot, and the leg may be supported in any direction. These are further positions that could derive from further modifications of hop standing. Now, positions derived from standing by alteration of the trunk. Leg stoop standing. Leg stoop standing. Look at this picture. The hips are flexed and the trunk, head and arms are relaxed so that they hang forward and downward. Balance is maintained by slight plantar flexion at the ankle joint, causes a backward inclination of the leg. Muscle work. Very little muscle work is required except in the region of ankle joint where the dorsiflexors stabilize the position of the joint while the intrinsic foot muscles grip the floors. Effect and uses. The amount of the forward flexion is dictated by the tension which develop in the hamstring and lumbar muscles. The position therefore may be used to train local relaxation of the upper body and to assist expiration. It is further used prior to extension exercise of the hips and spine, particularly those which occur progressively, as in uncurling to the upright position. For example, as you are seeing in previous slide that a person is in leg stoop standing, and if we raise it from this position, or we can say uncurling to the upright position, then we use this position with modification for extension exercise. This position is unsuitable for weak or elderly patients. Why? Because the dependent position of the body causes an increased blood flow to the head, obviously, which may be followed by the depletion on raising the upright position and consequent feeling of giddiness. When the knees are allowed to bend in this position, leg stoop, knee bend standing, tension on the hamstring and lumbar muscle is reduced, giving a feeling of relaxation right through the body. When you are in leg stoop standing and when you flex your knee, then your muscles further relax and your body is also in relaxation. Stoop standing. Look at this. Hip joints are flexed while the trunk, head and arms remain in alignment and inclined forward. The backward inclination of the legs is greater than in the previous position. The angle to which the trunk is inclined is usually about at right angle, but depend upon the tension of the hamstrings, which controls the forward tilting of the pelvis when the knees are straight. The muscles of the feet work as in the previous position. Extensions of the knee may work to counterbalance tension of the hamstrings. Further, longitudinal and transverse back muscles and extensions of the shoulder and elbow maintain the position against the pull of the gravity. Besides this, posterior neck muscles controlled by the prevertebral muscles support the head in alignment. Effect and uses. Strong work for the back and neck muscles with the stretching of the spine which occurs in the horizontal position train good posture of the upper back. Fixation in flexion of the lumbar spine localize movement to the joints above this level. It is therefore valuable but difficult position to hold correctly. Now we discuss positions derived for standing by alteration of legs and trunks. Forward standing. In this position, both modification, we modify legs position and with the combination of the trunk. One leg is placed directly forward to a distance of 3 feet length and this knee is bent. The back leg remains straight and the body is inclined forward in line with it. Muscle work. The extensors and foot muscles of the forward leg work strongly to support most of the weight, while the extensors of the back leg keep the trunk and leg straight. Here, role of extensor. Why the role of the leg extensors? Basically, they control the movement. They control excessive flexion of the forward leg. The dorsiflexors of the foot work to keep the heel on the ground. Head and trunk muscles work as in stoop standing, but as there is a degree of rotation and later tilting of pelvis away from the forward leg, balance is maintained by the action of the trunk rotators and lumbar muscles on this side. The muscle power and coordination required to hold this position is considerable, so it may be used in the treatment of the spinal curvatures. When support is given to the arm or shoulders, it is excellent position in which to utilize the body weight, either for giving pressure or resistance in the direction of the fallout. The forward leg may be placed outward or sideways. For that, if forward leg is maybe placed outward, then we call it as fall out outward standing, or sideways means fall out sideways standing, or the toes of the straight leg may be stretched so that they only rest on the floor, toe fall out standing. Lounge position are similar with regard to placing of legs, but the body always in a vertical position. So these are the derived position that we derive from standing by their modifications. This is the end of these positions. So we discuss further in coming lectures.